Good morning. I'd like to call this public hearing to order. Today is Monday, September 25th, 2023. The time is 11:31 a.m. I am at-large Councilmember Christina Henderson, Chair of the Committee on Health. Today, we will hear testimony from 7 nominees for various health professional licensing boards, the Board of Physical Therapy, the Board of Occupational Therapy, and the Board of Medicine. The nominees will all testify to their extensive qualifications for serving on these boards. Therefore, I will keep my introductions brief. The Board of Physical Therapy consists of 7 members appointed by the board, tasked with regulating the practice of physical therapy. The members must consist of 4 licensed physical therapists, 4 licensed physical therapists in the district, 2 licensed physical therapist assistants, and 1 consumer member. The mayor has nominated 3 individuals to serve on the Board of Physical Therapy. Rayan Hagona-Wordie has been nominated to the board as a licensed physical therapist for a term ending April 16th, 2024. She's the founder and CEO of JAW Therapy, which she founded in 2019 to enhance access to physical therapy services east of the Anacostia River through a mobile outpatient physical therapy services. She practiced physical therapy in the district since 2013 in settings including the DC Department of Corrections, outpatient settings, and home care. She is a resident of Ward 7. Dr. Nicholas Caylor has been nominated for reappointment as a licensed physical therapist for a term ending April 16th, 2025. He is the lead therapist to the medical surgical rehabilitation supervisor, at George Washington Hospital University. Dr. Caylor has served on the Board of Physical Therapy since September of 2018. Dr. Caylor has practiced physical therapy since 2009 and in the district since 2013. He is a Ward 5 resident. Ana Quiñones is nominated for reappointment as a licensed physical therapist assistant to serve for a term ending April 16, 2024. Ms. Quiñones has served on the Board of Physical Therapy since January of 2019. She is a physical therapy assistant at the MedStar National Rehabilitation Hospital. She has practiced as a physical therapy assistant since 2004 and in the district since 2008. She is a Ward 4 resident. The Board of Occupational Therapy regulates the practice of occupational therapy, including practice by occupational therapist assistants, dance therapists, and recreational therapists here in the District of Columbia. The board comprised of 5 members appointed by the mayor. These consist of 3 occupational therapists who are licensed in the district, 1 recreational therapist licensed in the district, and 1 consumer member. Charles Bonds has been nominated for reappointment as a recreational therapist registered in the district for a term ending April 16th, 2025. Mr. Bond is the director of C. Bond Consulting and practices as a recreational therapist at Edenbridge Pace at Skyland Town Center. Mr. Bond has served on the Board of Occupational Therapy since 2010. He's worked as a recreational therapist in the district for over 30 years. Mr. Bond is a Ward 1 resident. Finally, the Board of Medicine regulates the practice of medicine in the district and consists of 15 members appointed by the mayor. These include 10 licensed physicians, 4 consumer members, and the DC health director and or her designee. The mayor has nominated 3 individuals to serve on the Board of Medicine: Dr. Carolyn Gorman, Daanish Jones, and Dr. Padmaja Pavuluri. Okay. Dr. Gorman has been nominated for appointment as a licensed physician for a term ending August 5th, 2025. Dr. Gorman is currently an attending physician in the Department of Obstetrics and Gynecology with the Mid-Atlantic Permanente Medical Group. In this role, Dr. Gorman has worked in labor and delivery, welcoming thousands of healthy babies, and has supervised approximately 80 residents and physicians in the OBGYN care. Dr. Gorman is a Ward 6 resident. Daanish Jones has been nominated for appointment as a consumer member for a term ending on August 5th, 2025. Ms. Jones is an executive administrative assistant at Stand Together Foundation, which is a nonprofit philanthropic organization. With 20 years of experience in administrative services, Ms. Jones has extensive strategic communications and project management experience from working with Fortune 500 executives. She is a Ward 7 resident. And Dr. Pavuluri Yes, I pronounced that incorrectly, but I'm going to continue to work on that. Has been appointed as a licensed physician for a term to end August 3rd, 2026. Dr. Pavuluri is a pediatric hospitalist, associate chief of operations for the hospital medicine division at Children's National, and also serves as a associate professor at the Georgetown University School of Medicine. She is a Ward 3 resident. I do not see that any of my other colleagues are here, so we will go ahead and call up our panel of witnesses. We're going to do 2 panels. So the first panel will include the nominees for the Board of Physical Therapy and Occupational Therapy, and our second panel will be for the Board of Medicine. So I will give it a minute while we welcome these folks into the room. Okay, we'll start with Miss Hagona-Wordie. Whenever you're ready.
Hi, good morning.
Good morning.
Yep, Ms. Hagona-Wordie.
You can go ahead and present your testimony.
Okay. Give me 1 second. Sorry, give me 1 second. Okay. Hello and good morning, members of the committee and staff. My name is Rayan Hagona-Wordie, and it is my pleasure to receive your consideration for my nomination to serve on the DC Board of Physical Therapy. Thank you to Mayor Muriel Bowser for nominating me and for this appointment. And I am honored to have this opportunity to serve the residents of the District of Columbia. I've been a licensed physical therapist for over 11 years and have been practicing in the District of Columbia since 2013. I have worked in a variety of settings, including outpatient, home health, aquatic therapy, and senior living facilities, as well as corrections. Most of my career has focused on clinical work, and that is where I thrive. I've always enjoyed being a clinician and treating patients, irrespective of the setting. In 2015, I began working for Providence Hospital in Washington, D.C. on a contractual basis. The hospital at the time was actually contracted to provide physical therapy services to the D.C. Department of Corrections. I worked at the hospital's pool providing aquatic therapy on the side and began to work at the Department of Corrections treating the inmate population there part-time as well. Working at the DC Department of Corrections has been the role I felt the most proud of, providing physical therapy to individuals who have historically faced barriers in terms of access to medical services, including physical therapy, makes me feel like I'm providing a great service to my community. The majority of the patients that I treat come from underserved communities in DC, and many have never had interactions with physical therapy practitioners before I began working with them. The outcomes that we have seen with these patients have been exemplary thus far. And 8 years later, I still continue to work there on a contractual part-time basis. So apart from being a physical therapist, I also serve my community by volunteering for a nonprofit organization in DC named HEART, which stands for Health Equity Anti-Racism Team. It was started by 2 physical therapists in 2020 who wanted to promote equity in healthcare. In 2021 to 2023, I assisted HEART with a pipeline project that was geared towards exposing high school students in underserved communities in DC to the physical therapy field and presenting them with resources to possibly choose physical therapy as a higher education option. I presented at some of these presentations and facilitated student sessions at Eastern High School. During that time, I also worked with members of HEART on a health coaching mentorship program that was called Move, Heal, Live, in conjunction with a privately owned physical therapy clinic in Ward 7, DC. Physical therapy is my profession and what I know best, but it's also my passion. And being able to share my passion with my community gives me the greatest sense of accomplishment. So my interest in joining the Board of Physical Therapy began shortly after moving into DC in 2013. I became a licensed physical therapist in that year, and I remember initially questioning why the district had the highest requirements of continuing education units in the country, to renew one's license to practice. A year later, I received an email from the DC Board of Physical Therapy inviting licensees to attend a conference that offered free continuing education credits to licensees. So I attended that conference and was able to receive the answer to my questions. DC has the highest CEU requirements in the country, not to burden the therapist, but because it wants to protect both the practitioners and the patients by ensuring clinical competence and the highest level of practice of care. And by requiring the clinicians like myself to undergo 40 hours of continuing education credits in topics relevant to current practice every 2 years, it helps keep us clinicians up to date on the best evidence-based practice. So knowing that the 40 CEU requirement can be expensive for clinicians, the board also offered free CEUs to licensees. And at that conference, I met the chair of the board at the time, Tim Vidal, and other board members, and began to ask about the work that they do. And that's where I learned about how our practice is regulated and how the board helps to protect both the providers and the consumers. And I learned about how the board advocates for clinicians like myself to ensure fair reimbursement for our services. And I was just really impressed by the dedication of these board members, the dedication that they had to our profession and to the community and to serve. And I aspired, to one day be able to serve my community and the residents of my city in the same way. So if I am confirmed today, I hope that I can become a vital member to this board and plan to serve the residents of DC to the best of my abilities. I will engage with the public and encourage more participation from both licensees and non-physical therapist residents for board hearings. I would like to serve my fellow clinicians by helping pass legislation that will help to decrease barriers that they're facing in their ability to practice. I want to serve the residents of the district by helping pass legislation that will improve their access to healthcare and promote equity in healthcare and improve their safety and health outcomes. The board has an essential role in regulating the licensing of physical therapists and the practice of physical therapy. The profession is growing in popularity because of an aging baby boomer population that wants to stay active and an increase in vital physical therapy services. And as a result, the demand for physical therapy is only going to continue to grow. According to the U.S. Bureau of Labor Statistics, it's predicted that the demand will grow by 17% over the next decade, which is faster than the average growth of other occupations. So I'm certain that with these changes, we'll be seeing an increased number of physical therapists flocking to the district and gaining licensure to practice. So I'm excited about this growth, and I want to be a part of shaping the future of our practice. So I thank you again for this opportunity to testify before the committee today, and I welcome any questions that you may have.
Thank you so much for your testimony. Dr. Caylor.
Good morning, members of the committee, Councilmember Henderson and staff. My name is Dr. Nicholas Caylor, and it is my pleasure to receive your consideration for my nomination to serve on the Board of Physical Therapy for the District of Columbia. I'm grateful for Mayor Muriel Bowser's nomination, and I'm honored to have been able to serve the residents of our district in this capacity for the past several years. I received my Doctor of Physical Therapy degree from the MGH Institute of Health Professions in Boston, Massachusetts in 2010. For the next 3 years, I practiced at Boston Medical Center, providing physical therapy services to patients in the acute trauma hospital and critical care settings. I was working in Boston during the Boston Marathon bombing and provided rehabilitation to victims of that terrible event. My experiences in Boston cemented for me the importance of working in a trauma center and teaching hospital. So in 2013, when I moved to Washington, D.C., I began practicing at the George Washington University Hospital, where I continue to work today. At GW, I developed our hospital's critical care competency and training program for our physical and occupational therapists. I helped develop guidelines and evidence-based protocols for practice in the ICU that was implemented across our parent company's entire acute care division of over 20 hospitals. And I co-led the development of a program that embedded a physical therapist in the emergency department to fill a significant gap in care that improved needed access to services, reduced unnecessary admissions, and decreased overall wait times. I currently serve as a supervisor to our team of 75 clinicians across 5 different departments. I also have the honor to serve as an adjunct faculty member for the Doctor of Physical Therapy program at George Washington University's School of Medicine and Health Sciences, where I've had the privilege of training students in the practice of acute care physical therapy. I became a healthcare provider to help people, and as I've grown in my career, the scope of that personal directive has necessarily broadened. As a supervisor and adjunct professor, I can do more to impact the care of patients than I could as a staff therapist, through training, establishing standards and practices, and through supporting and nurturing clinical excellence and growth. The same is true of being a member of the Board of Physical Therapy. In this role, we are tasked with regulating the practice of physical therapy, the goals of which are to protect our citizens from health risks and to ensure that the public health and welfare are being served. An effective regulatory framework fosters excellence, quality, and safety in healthcare practice across the entire district. I volunteered to serve on the Board of Physical Therapy to contribute to those worthy goals. Currently, our board makeup has representation from across the continuum of practice in physical therapy. Having subject matter experts in different practice areas increases our board's total depth of knowledge, allowing for meaningful discussions of complex issues and questions, and ultimately resulting in a more effective execution of the board's mission. I'm grateful that our board has its current level of membership, not to mention its excellent legal, investigative, and administrative support and leadership. Nevertheless, there are still gaps in our expertise as we still have open seats on our board. Ultimately, one of my goals is to collaborate with other board members, leadership, community partners, and professional organizations in recruiting to fill these gaps. The health of our residents would benefit from additional insight and expertise regarding the practice of physical therapy. I also expect healthcare board membership as a whole will be improved by legislative efforts that consider broadening membership eligibility to include those individuals who work in the district caring for DC residents, hold a DC professional license, but are not necessarily district residents themselves. One additional goal of mine on the board is to contribute to the updating of the language of our municipal regulations under the Health Occupations Revision Act, specifically as it relates to the practice of physical therapist assistance. One consequence of the current language is that it indirectly but significantly limits the availability of these services to our citizens by requiring these licensed professionals to operate under direct supervision as opposed to general supervision. Not only is this current practice prohibitively prescriptive, it is not in line with best practice and is internally inconsistent with the same DC regulations governing occupational therapy and occupational therapy assistance. I've been honored and proud to serve our residents as a member of the Board of Physical Therapy, and I would be honored and humbled to be confirmed to continue to do so. Thank you very much, members of the committee and Councilmember Henderson, for this opportunity to testify and for your time. I would be happy to answer any questions that you or the members of the committee may have at this time. Thank you.
Thank you, Dr. Caylor. I did see Ms. Quiñones, but I think she might have dropped. So we're gonna go to Mr. Bond, and then hopefully she'll come back in. Mr. Bond?
Good morning, Councilmember Henderson, members of the committee and staff. My name is Charles Bond, and I appreciate the opportunity to testify today regarding my nomination as recreational therapist of the Board of Occupational Therapy. I am grateful to Mayor Bowser for nominating me, and if confirmed, I will be honored to have the opportunity to serve the residents of the District of Columbia. My experience working in the healthcare field spans over 40 years. I have served as a registered recreational therapist for 28 years, a certified therapeutic recreation specialist for 28 years, and 6 years as a certified dementia practitioner. It has been a privilege to grow in this industry as a servant leader and to serve those of vulnerable, underserved, and overlooked populations. As I have served those under my care, I have done my best to foster an environment of learning and excitement while enhancing quality of life. My number one goal continues to be to protect the interests and well-being of the customers under my care. As I continue to progress in this field, serving this population on the Board of Occupational Therapy, it would give me a chance to bring my perspectives and as an experienced practitioner to the context of policy, oversight, and licensing. My passion for this industry comes from my upbringing. Being raised by my grandparents taught me essential core values and aided in my understanding a senior perspective. As a young practitioner, I was recognized for the detail and care of the seniors I worked with each day. I took pride in the way my customers presented themselves. I wanted to instill a sense of purpose, self-identity back into their lives. And as I grew into the industry and my craft, I was recognized by the American Therapeutic Recreation Association for my service leadership and dedication to the profession. I also served on the board of directors of the American Therapeutic Recreation Association as a member at large, and I served as co-chair of the federal and state public policy. In addition, I serve as a site visitor and surveyor for the Committee on Accreditation of Recreational Therapy Education, or CARF. My focus on attention to detail and leadership experience still presents itself in my work as a recreational therapist. At Edenbridge PACE at Skyland Town Center in Ward 7, PACE, which stands for Programs of All-Inclusive Care for the Elderly, is a nationally recognized model designed for individuals who wish to stay at home. Currently, Edenbridge serves residents of Ward 7 and 8 in the District of Columbia by providing home support services to its community members. Volunteering my time for the board would allow me to serve in a grand capacity by using my years of experience as a subject matter expert to be a positive change agent in the field of recreational therapy. As an expert in the healthcare field with day-to-day experience with end users, our patients and clients, I believe my expertise will bring a balance to the board as a representative. My educational and professional background has equipped me to tap into research obtained over the years and provided a well-rounded perspective. My goal in working with other board members is to be collaborative and also to challenge the way each individual thinks, learn from colleagues on the board, and challenge all of us collectively to become forward thinkers of the healthcare industry. I feel I am qualified for this role on the board because I have been a resident of Ward 1 for 39 years, and I have represented a high qualified group of registered recreational therapists in the District of Columbia. I am proud to say that I am a man of the city, serving residents with care and compassion. My vision for the board is to see the board serve as a national leader in defining regulatory compliance that oversees the practice of recreational therapy and occupational therapy. I believe it is essential to bring more light and exposure to both occupational and recreational therapy as it overlaps benefits. In doing so, I believe it would continue to enhance the vision and mission of the board while protecting the interests of the public. I will continue to be a strong pillar of the healthcare field and a beacon of light for recreational therapists who want to grow and learn from other practitioners in the therapeutic field. Thank you, Council Member Henderson, for the opportunity to testify before this committee, and I will be happy to respond to questions from you and the members of the committee. Thank you.
Thank you, Mr. Bond. Ms. Quiñones.
Yes, I'm sorry, I got some connections issues. Here, my name is Ana Patricia Quiñones. I've been a DC resident for 18 years, and I'm a physical therapist for 19 years. I initially worked in Southern Maryland Hospital and then moved over to the district and been working at the National Rehabilitation Hospital by MedStar since 2008. I've been working in the outpatient clinic with the neurological patients, where I can see many complex patients, not only by condition, but many other comorbidities and social issues. So my idea to join the board, the PT physical therapy board, as a physical therapist assistant, want to advocate for my profession as a physical therapist assistant. Many of us live, that's our bread on our table, and we're trying to get our profession a little bit advanced and work, cooperate and collaborate with the physical therapists for the well-being of the community, the patients, and the profession. I've been working with the board for over almost 4 years, and it's been a nice experience for my career, learning a lot from every member of the board, and trying to advocate for the patient safety and for the therapist profession. So it's been an honor to be appointed for this position at the board, and I'll be happy to continue to be working with the board.
Great. Thank you so much. I just have a few questions for the four of you. I first want to start with reminding you that if you haven't submitted your written testimony for the record, if you could go to the council website, to the hearings page, and just go ahead and upload these great statements that you have already given us, so that we can have them for the record, that would be fantastic. So my first question for all four of the witnesses who have already testified, in our conversations with DC Health, as well as with chairs of the board, excuse me, we recognize that all of the boards have various time commitments outside of just the official meetings that take in place. I just want to make sure, have all of you been briefed on the time commitment for your particular boards? And do you believe you have the time needed to serve or continue to serve? Dr. Caylor, if you want to go first.
Sure, I'll go first. Yes, I have no problems with that. I've been serving on the board already, so I'm aware of the time commitments and the availability of them, and I should be able to continue to meet those requirements.
Great. Ms. Quiñones?
Yes, I've been at the board for almost 4 years, so I have the time set up for them to commit.
Great. Mr. Bond, I know you've been on your board for 13 years, so I just want to make sure you're still good to go.
I'm still good to go.
All right. Ms. Hagona-Wordie?
Yeah, so I have been briefed on what the time commitment is and what the expectations are, and I am willing and ready to commit to that.
Wonderful. I appreciate all of your statements. They definitely gave us a great picture in terms of the richness of diversity of your backgrounds. I'm curious, in terms of, excuse me, the field of physical therapy and the field of occupational therapy, what do you think is one of our biggest challenges here in the district as it pertains to both of the professions? Whoever wants to go first is fine.
I'd be happy to go first. One of the things that I mentioned in my testimony was about the role of assistance in the care of patients, specifically as it relates to physical therapy. So there is a difference currently between the two disciplines and how the HORA allows occupational therapist assistants to be able to practice in a way that's different from PT assistants. So physical therapist assistants are required to operate under direct supervision, which means that the physical therapist must be personally present and immediately available within the treatment area. So they basically have to be in the same room that treatment is occurring. Mm-hmm. Whereas for the occupational therapist assistants, they are able to operate under general supervision, which means that the supervisor, they are available on the premises or available by a communications device, but they don't have to be right there in the room. They just have to be able to be on site in the event of an emergency within 2 hours or available by a communication device. That difference between the two allows certified occupational therapist assistants to be able to practice more readily, and our PT assistant numbers eventually have been dropping slowly over each renewal cycle because it's more challenging for institutions and facilities to hire physical therapist assistants given this restriction on supervision, since assistants are also licensed professionals. I think this language, I don't actually know the history of this language for why it operates this way. I think maybe some of my other board members might have more familiarity with it, but it does really limit our ability to incorporate PTAs into our practice in this area.
That's a very interesting perspective, and hopefully in the conversation around the HORA, we can address some of these scope of practice issues. Mr. Bond?
Would you repeat the question for me, please?
I guess my question was really around, what do you see as one of the biggest challenge areas or areas for improvement in terms of the particular practice and the work that you all do here in the district? So for occupational therapists, what would you say is one of our biggest challenge areas here in DC around OTs?
Okay, well, as a recreational therapist, one of the biggest challenges that we have is not being a licensed profession at the present time. We are registered, and the Board of Occupational Therapy is currently advocating for rec therapy to be a licensed profession in the District of Columbia. And I truly believe that once that becomes a reality, that it would just enhance the quality and the delivery of services for recreational therapy in the District of Columbia. At the present time, there's a small pool of recreational therapists in the District of Columbia. So that would truly be a blessing. It would make a difference to the consumers of services here in the District of Columbia. And also, not as it, well, also one of the blessings that I would say, having a recreational therapist on the Board of Occupational Therapy, it has enhanced our profession, and it has really built a bond, a strong relationship with recreational therapy and occupational therapy, because a lot of the services, they overlap. So that in itself, just having the opportunity to have a recreational therapist to serve on the board has truly been a blessing, because prior to Chapter 72 for recreational therapy, you registered and you just paid the fees every 2 years, and that was it. And now having a recreational therapist on the board, it has enhanced the value, the quality, and understanding of the services that are provided for our consumers and customers here in the district.
Thank you, Mr. Bond. Ms. Hagona-Wordie? It's okay. It happens. You're still on mute.
Okay, there we go. Sorry.
There you go.
Yeah, so I think one of the challenges, which I don't believe is a challenge anymore, but was the like licensure issue, like across state lines, I would say, I guess, like the compact licensure that was going on, because, you know, the district is pretty small, and I have I know a lot of physical therapists, for instance, that practice in multiple settings at the same time. So, you know, they would practice like in DC, in Maryland, in Virginia. And I think one of the biggest challenges was for people to try to hold licenses in all of those areas, especially, like I said, given the, you know, the rigorous continuing education requirements that DC had. And then, you know, maintaining the fees, you know, paying the fees to maintain a license in each of those. So something that's helped recently overcome that is the compact license, which offers therapists opportunity to, you know, hold the license that allows them to practice in multiple areas. And so DC joining that compact license, I think, really helped overcome that obstacle.
Great, thank you. Ms. Quiñones? One of the big challenges you see in the field?
Well, one of the obstacles is, as Dr. Caylor mentioned, that physical therapist assistants, we still working under direct supervision that is been a very high obstacle for patient care, because with more physical therapist assistant be able to care for patients will have more access to care. And that is important for, especially my setting, we will have outpatient clinic with the more complex patients population, and they have to wait a long wait to be able to be seen for a therapist because of the limited amount of clinicians available. So that will be an important issue to address and be able to lift that restriction for direct supervision and become some more general supervision for physical therapist assistants. That will be my take on the board.
Thank you. Thank you all. I question for the folks who had already served on the boards, who are there for reappointments. Have you all had any conversations or interactions with, say, the Department of Healthcare Finance around some challenges that providers might have registering for Medicaid? I'm not sure if that's come up in any of the meetings that you all have had.
For the Board of Physical Therapy, it's not come up to my knowledge.
Okay, Mr. Bond?
Not that I'm aware of. I don't recall any conversations during any of the meetings or sessions.
Okay. That's not necessarily unique to all of you. I ask these questions of all of the boards, primarily because equity of access is important to the committee. It's important to me. And we know that obviously providers have choice in terms of whether or not they accept Medicaid or not. And so if you're hearing from the workforce that they're having particular challenges, or there's some particular reason as to why a provider doesn't want to accept a patient who has Medicaid for, physical therapy or for OT services, that would be important for us to know, so we can try to address some of those issues to make sure that access isn't just access in name, but that, all district residents actually have access to the services that are being provided. One last question, I guess I'm just interested is for our reappointees, why you guys want to come back. Is there one additional thing that you're hoping for accomplishing on the board? And don't take this the wrong way. We need you. Please stay. Thank you so much for your service. But I'm just curious, is there something like, I want to make sure that we get X done in, the next couple of years of my term? And if you don't have one, that's fine too. I'm just curious.
Okay.
For me, I definitely find the work very meaningful. That's a big reason why I'm doing it. Actually, I mentioned in my testimony, and Anna also mentioned this issue with the PT assistants. That language is actually the reason why I joined the board in the first place. But
okay,
we all know how long the HORA takes to address. So
we're still waiting, DC Health. We're still waiting. Mr. Bond?
The reason that I have served, on the board as long as I have, it's just the commitment, just to make sure that we obtain licensure for recreational therapy in the District of Columbia. There are a lot of other states that are working towards licensure. And one of the unique things about the district is just the structure of the board, and just being a part of the board has really given me an additional voice. And that's the end goal for me, is just to make sure, if it's all possible, that recreational therapy is a licensed profession in the District of Columbia.
I hear
that's
you.
the goal. Yeah.
Ms. Quiñones?
Well, I'm joined with Dr. Caylor. The interest for me to go to the board is to allow the physical therapist to work a little bit more independently. But I also enjoy the learning process we have into the board. I've been learning a lot about the physical therapy profession itself and how the district move around. I'm a DC resident for 18 years, so I have to learn a lot of stuff about how the district moves and the laws and all that stuff. So I enjoy very much being part of the board.
Great. And Ms. Hagona-Wordie, I wasn't asking you that particular question because I thought that you covered it pretty strongly in your testimony in terms of your interest of your desire to serve on the board. One last question for this panel, Dr. Caylor, as an educator, I'm curious, how's our pipeline of new physical therapists being trained in the district and then also choosing to stay and work here in the district?
That's a great question. The pipeline seems good in terms of the volume of students that come through, although it's hard for me to know, certainly since my realm is limited within the GW system. And so we often get a number of GW graduates that come to the hospital and students that way. And we do see a lot of applicants from other jurisdictions who do come to work in the district. As far as the number of students who work here or get their degrees here and then move on to other areas, I think that's pretty common for being in the district just because of the nature of living here. It does tend to be a more transient city for people who are coming here for school or for work. But I don't know if it's been particularly problematic.
Okay. All right. Well, again, like I said, I appreciate the four of you and your decision to serve. We're just checking the numbers here, and your boards, even with your confirmations, will still have vacancies. So I hope that you are recruiting your fellow colleagues to join you in this endeavor. And this is the PSA for anyone who is watching, who is interested in serving on any of our professional licensing boards. You could visit the Mayor's Office of Talent and Appointments website and submit your information on that front. I am going to move on to the next panel. But again, I want to say for the four of you, if you could please, we do need your testimony. So right after this, just go upload it on the website or email it to us so we can have that. The committee will be considering your nominations for markup tomorrow. So we do need these today. And with that, we will go on to the next panel. Thank you again. I have Daanish Jones, Dr. Carolyn Gorman, and Dr. Padmaja. And I think everybody is here. So Ms. Jones, why don't you go ahead and present your testimony?
So good morning, everyone. Chairperson and members of the committee. I am Daanish Jones, and it is my pleasure to receive your consideration for my nomination to serve on the DC Board of Medicine as a consumer member. I'm grateful to Mayor Muriel Bowser for nominating me, and I'm honored to have this opportunity to serve the residents of our district. As a passionate advocate for patient rights and healthcare improvement, I believe that my unique perspective and experience as a healthcare consumer will be an asset to the board's decision-making and policy development processes. As a true native to DC, I will be proud to serve on the Board of Medicine to continue to put our residents in the best hands possible for medical care. Thanks to my attending last year's Women Equality Day event, I learned that it was possible for me to use my voice in an important way within the medical care field as a DC consumer member. The thing that most interested me in serving on the board was my ability to finally use my voice. As I stated in my application, for the past 16 years, I've suffered from a not so apparent disability called Samter's triad. Samter's triad is a chronic illness comprised of severe asthma, nasal polyps, and an allergy to aspirin and NSAIDs. This condition has robbed me of a healthy quality of life because the medication it takes to manage this condition. I was diagnosed with osteopenia, which is the beginning stages of osteoporosis, at the age of 26. And by the age of 28, I had shrunk 2 full inches in height due to my severe bone decay and loss. I was diagnosed with a medical eye condition that that causes the pressure in my eyes to increase at such a rapid and alarming pace that it is necessary for me to use a special eye drop that is said to aid in slowing the process of my progressive eye loss that I was told may cause me blindness at any time in the near future. The severe asthma is the worst of them all. I'm not a fully mobile person. Walking, moving, exercising, and really any form of physical exertion can send me into a full-blown attack. At one point, I was not able to speak a full sentence due to my extreme cough. You can imagine the challenges I had facing working as an executive assistant who is tasked to answer the phone and take messages. Having lost my voice at one point in almost my life has fueled me to dedicate my life to now using my voice to forge positive changes in beautiful ways that could change the world in my small ability. Now, why am I sharing all this? Having personally navigated the healthcare system for many years, I have witnessed the challenges and hardships faced by patients and on a daily basis as it pertains to working with their doctors, getting their prescriptions, and battling the sometimes overwhelming side effects of their prescribed medication. I actively engage in consumer advocacy initiatives and participate in various patient support groups. These activities have provided me with valuable insights into the challenges faced by individuals from different demographics, ensuring that my perspective is well-rounded and inclusive. If appointed as a consumer member, I pledge to prioritize the interests and welfare of patients by diligently working towards improving access to quality care, enhancing patient safety measures, and advocating for transparent and effective communication between the medical community and the public. By leveraging my unique experiences and insights, I aim to contribute to the board's mission of advancing the practice of medicine in a patient-centric manner. So thank you, Chairperson, for the opportunity to testify before this committee and for considering my nomination for the position of consumer member to the Board of Medicine. I am confident that my passion, knowledge, and commitment to improving healthcare experiences will enable me to make meaningful contributions to the board's important work. I will be happy to respond to any questions from any members of the committee.
Thank you so much for your testimony. Dr. Gorman?
Hi, good morning, Chairperson Henderson and members of the committee. My name is Carolyn Gorman, and it is my pleasure to receive your consideration for my nomination to serve on the DC Board of Medicine. I'm grateful to Mayor Muriel Bowser for nominating me and honored to have this opportunity to serve the residents of our district. I am an obstetrician gynecologist who works with the Mid-Atlantic Permanente Medical Group, and I practice at the Capitol Hill Medical Center, and I've been practicing there since 2013. My journey to becoming a physician began with completing medical school at the Virginia Commonwealth University, followed by a residency at Advocate Lutheran General Hospital outside of Chicago. After this, I returned to the East Coast and began practicing as an attending physician at Georgetown University, where I practiced there until 2011, which was for 5 years. In addition to my clinical duties, I serve as a physician director of communication at the Mid-Atlantic Permanente Medical Group. Working alongside a dedicated team, I have successfully developed effective communication tools and programs to support over 1,600 Permanente physicians in the region. This role has allowed me to demonstrate my leadership and communication skills, ensuring that the best communication practices are efficiently disseminated and physicians are empowered with the resources they need to provide exceptional patient care. Volunteerism is a deeply ingrained part of who I am. It has taken me to various corners of the world, from Guatemala to Israel, where I have had the privilege of making a positive impact on diverse communities. Contributing my medical expertise and services to those in need has been a fulfilling journey, and it has further solidified my commitment to improving access to healthcare and promoting wellness on a global scale. Additionally, my passion for education has led me to combine it with my medical background by delivering lectures to Permanente members on various women's health topics. This initiative allows me to share in the latest advancements in medical knowledge, raise awareness about critical health issues, and empower individuals to take charge of their well-being. Education has the power to transform lives, and I am dedicated to playing an active role in fostering medical literacy within our community. I am motivated to volunteer my time for the DC Board of Medicine because I have a genuine passion for improving healthcare in our community. Throughout my career as a physician, I have witnessed firsthand the challenges and opportunities in our healthcare system. By joining the board, I can contribute my expertise and insights to help develop policies that address these challenges and drive positive change for the benefits of all DC residents. As a candidate for the DC Board of Medicine, one of my primary goals is to leverage my background in obstetrics and gynecology to advocate for evidence-based medical policies. I believe that by promoting evidence-based practices, we can ensure that healthcare decisions are made on the foundation of reliable research and data, leading to better patient outcomes and improved overall health quality in the region. Another crucial objective I aim to pursue is supporting equitable healthcare across all wards, particularly concerning maternal and child health. It is vital to address healthcare disparities and ensure that all residents, regardless of their socioeconomic status or geographic location, have access to comprehensive and high-quality maternal and child healthcare services. Additionally, with the ongoing advancement of artificial intelligence in the medical field, I am committed to supporting physicians' ability to utilize AI responsibly and effectively. While AI has the potential to revolutionize healthcare, it is essential to strike a balance between innovation and patient safety. I will work diligently to establish guidelines that prioritize patient privacy and safety while harnessing the benefits of AI technology to improve medical diagnoses, treatment, and patient care in Washington, D.C. Ultimately, I believe I am the best nominee for this position due to my extensive experience as a licensed physician in the D.C. area, coupled with my involvement in physician communication and healthcare program development. My dedication to volunteerism and my commitment to improving healthcare outcomes through evidence-based practices and equitable access make me a strong advocate for the health and well-being of our community. By serving on the DC Board of Medicine, I am confident that I can contribute meaningfully to shaping the future of healthcare policies and positively impact the lives of DC residents. Thank you, Chairperson Henderson, for the opportunity to testify before this committee. I'd be happy to respond to questions from you and the members of the committee.
Thank you, Dr. Gorman. Dr. Pavuluri?
Hi, good afternoon, Chairperson Henderson, council members and staff. And you did great with my name. It's Pavuluri. It sounds Italian, but I'm really not. My name is Dr. Padmaja Pavuluri, and it's my pleasure to receive your consideration for my nomination to serve on the Board of Medicine as a new appointee. I'm grateful to Mayor Muriel Bowser for nominating me and honored to have this opportunity to serve the residents of our district. As a proud resident of Washington, D.C. and a pediatric hospitalist at Children's National since 2007 and a physician since 2001, my commitment to promoting excellent patient care and my passion for driving systems improvements to ensure workforce sustainability and satisfaction make me an ideal candidate for this position. Throughout my medical career, I've had an privilege for caring for countless young patients and their families in the heart of our nation's capital. Witnessing the resilience of children and their ability to thrive even under challenging circumstances has been inspiring and transformative. My work as a pediatric hospitalist has instilled in me a profound sense of responsibility to advocate for their health and the well-being of every child in our community. Specifically, as an advocate for systems improvement and trained in quality improvement science, I've spearheaded a myriad of initiatives, both locally and regionally, to streamline care and enhance communication and cooperation among our staff, patients, and their families. Fostering a collaborative and interprofessional approach is essential for addressing the complex medical challenges we face today, including transitions of care for our most vulnerable children. I witnessed this personally as well as a physician attending at the HSC Pediatric Center in Northeast Washington, D.C. I've actively championed the importance of family-centered care in both clinical practice and systems-wide improvements, involving families in healthcare decisions and providing them with the necessary support is essential for achieving the best possible outcomes for our young patients. In my current role as Associate Chief for Operations at Children's National Hospital, one of my primary goals has been to ensure workforce sustainability and satisfaction for my over 100 colleagues who practice as part of a regional network of pediatric hospitalists and support staff across the DMV region. I understand that the well-being of healthcare professionals directly correlates with the quality of work and care that they provide. Through strategic planning and innovative practices, my approach emphasizes collaborative teamwork and streamlining processes that reduce administrative burden so they can focus on patient care and the interests that they love. By nurturing talent and encouraging work-life balance, we can retain skilled healthcare professionals who are committed to providing exceptional care to the children of the DMV. If appointed to the Washington, D.C. Board of Medicine, I'm eager to leverage my expertise and intimate knowledge of the local healthcare landscape here to address some of the pressing healthcare challenges facing our workforce and community. My vision is to advocate for patient-centric policies, foster a culture of continuous improvement, and work towards achieving equitable healthcare access. Especially now, as a mother of 2 elementary school girls proudly enrolled in DCPS, I'm acutely aware of the importance of providing healthcare services that are not only efficient and effective, but also compassionate, accessible, and equitable. I'm committed to upholding the highest standards of medical care and to work collaboratively with my esteemed colleagues to ensure a healthier and more vibrant future for our city. Thanks for considering my nomination. I welcome the opportunity to discuss my vision further. Thank you.
Thank you. And again, thank you to all of you for your willingness to serve, your fellow professionals, as well as, residents in the District of Columbia. Dr. Gorman, I was especially excited that we're finally getting our OBGYN member to the Board of Medicine. There's a lot of work that needs to be done in the area of maternal health. And so I hope that you are ready, because I believe that the Board of Medicine and DC Health is most certainly going to put your expertise to work here. In terms of the Board of Medicine's role in general, I'll ask a question that I have asked the previous panel about their particular boards, but what do you feel like, for all of you, the biggest challenge is currently facing the Board of Medicine or individuals who are licensed under that board? Don't all speak at once. Whoever wants to go first.
I think I can speak from a pediatric hospitalist perspective. Certainly the COVID-19 pandemic really heightened it, but really, and as I've highlighted in my statement, it's really addressing how we can sustain our workforce so that they are happy and as liberated as possible to do the best patient care that they love to do, while also being supported and continually learning. I don't necessarily have the solutions, but from my perspective, it's my mantra has always been making it as easy as possible for people to do their job and ensuring that providers are practicing at the top of their license. So that's really my vision that I want to bring to the board, is how we can optimize every provider's expertise to do the care that they want in the most effective and efficient way possible.
Thank you. Dr. Gorman?
Yeah, I'll try. I do agree with Dr. Pavuluri that I think, retaining physicians has been a challenge, especially since the pandemic and the Great Resignation. I certainly felt that in my group, we definitely saw that across all specialties. And so, part of it is making things easier for physicians. And we have a saying, if we take care of our physicians, they'll take care of our patients. So making sure that we can, support our physicians, whether it's from, something as easy as a lot of our physicians will get licensed in all 3 states. And somehow if there were, an ability to be able to get, with one license application, or at least streamline the process so you're not dealing with 3 different jurisdictions, 3 different time periods, 3 different each one has their own rules and requirements about CMEs, and have to have a certain amount of hours in each of these specific topics. If there was an ability to actually kind of coordinate across districts, that would be just one small step, but that would actually kind of make life easier. So again, I don't have a lot of solutions on it, but I think as we can get to work and try to take care of our physicians, again, they'll take care of the patients.
I think that's an excellent way. And Dr. Pavuluri, when you said making sure that providers are practicing at the top of their licenses, I think that a lot of providers would certainly agree with that. Is the overwhelming desire, not just for the Board of Medicine, but for all of our professional boards, that folks are able to practice at the top of their license and truly use their skills and expertise to serve patients and residents. Dr. Pavuluri, when I listening to your testimony, what's one thing that definitely stood out to me was that your oversight of the workflow efficiency at Children's National. How do you plan to bring some of that background to the Board of Medicine from an efficiency standpoint, which is a board that I'm not sure that's the word that most people would use to describe any of our boards as being efficient.
Thank you for noticing that. That is one of my passions, and obviously I'm a newbie to this, so my first 10 duties will be understanding the board and learning, and certainly there's members there who've been members for much longer than I have, and working with the staff who support the board. That's really job number 1. And then I think coming as an outsider, I think it'll give me that perspective to say what could be potentially done more efficiently, but let's understand the reasons why it's the current state. And I would also, as much as the board is willing to indulge me, is bringing my QI expertise and perspective, is really stepping back. What are the barriers? What are the pain points? But what are the easy points? What are the joyful points? And trying to map out very clear processes so it's transparent to not only the board members and the support staff, but also the physicians that we are licensing.
Thank you. And Ms. Jones, how do you envision leveraging your lived experience as someone who has a chronic illness to ensure that holistic care and patient well-being is prioritized by licensed medical professionals in the district as part of this board?
Well, I think that like Dr. I might screw it up, I'm so sorry, Pavuluri mentioned that it is very important for me to understand the totality of the role of the medical profession and patient. Understand how it all fits together, how it all works together. That is very important to me to first learn that and then share personal experiences. I feel like sometimes that as a patient, our voice is not always heard. So I will definitely love to leverage my voice and fill in those gaps that might be there and unclear between patient and doctor or medical professional. So that is how I definitely understand things from a patient, but also I want to learn the from through the eyes of the professional.
Great. And Dr. Gorman, I have to ask, I mentioned it before in terms of your background as OBGYN and sort of maternal health outcomes pieces, but how do you see your role in sort of promoting that as, well, not just for maternal health, but also Dr. Pavuluri from the pediatric side too. I'm sure there are providers who are like, well, I don't deal with children. I don't deal with pregnant women, but how can you sort of leverage your experience to put a special emphasis on that work here in the district?
I'll go. I think first off, I want to commend the mayor. I think she's had actually, and in preparing for the testimony, looking at all the programs we have for maternal child support. I think, again, education is a really is a passion of mine, and I would want to focus and make sure that in all districts, everybody's aware of all the amazing programs that actually are out there already. And I just don't know if everybody is aware of it. And, in terms of getting our licensed physicians and to be a part of that change, and also be aware of all the programs so they can be advocates for their patients, and also disseminate some of this amazing opportunities out there for moms, young moms, and moms across all districts that may need additional support.
Thank you. I asked the previous panel this, and all of you are, oh, my notes are correct. All of you are fresh appointments. So this is important. Have you been briefed on the time commitment in terms of what it will take for the board? These are volunteer positions, but they're super, super important to the work, to the profession. Have you been briefed on the time commitment, and do you believe that you have the time needed to serve?
Yes, I've been briefed, and I do have the time to serve.
Yes, I've been briefed and do have the time to serve as well. Thank you.
I have been briefed as well, and I definitely have the time to serve. I'm very excited.
Awesome. And I am excited for all of your enthusiasm on this. After you all are confirmed, we will still have vacancies on this board. So if you have any other colleagues who would like to join you in this endeavor, again, this is my PSA, to have them reach out to the Mayor's Office of Talent and Appointments. I don't have any further questions at this time. Excuse me. I will just say again, if we don't have your written statement, if you can, please provide that to us for the record. We appreciate, again, all of your work you have done to get to this point, and we're going to try to move these nominations quite quickly. I again want to thank all of you, not just this panel, but the previous panel too, for agreeing to serve the district as a member of a mayoral board. Again, for those watching at home, I feel like this is like this is like QVC. I'm giving out like PSAs like 4 or 5 times just in case people didn't hear me. But if you are interested in volunteering for a board, it is truly an excellent way to give back to the district and inform program and policy decisions, as you've heard from some of the nominees today as some of their interests. But this concludes today's roundtable on the nominations for the Board of Physical Therapy, the Board of Occupational Therapy, and the Board of Medicine. Tomorrow, Tuesday, September 26th at 1 p.m., the committee will hold a markup to vote on these 7 nominations, as well as 3 additional bills before the committee. Those bills are Bill 25-124, the Prior Authorization Reform Amendment Act of 2023, Bill 25-73, the Ambulatory Surgical Facility Amendment Act of 2023, and Bill 25-312, the Health Professional Licensing Board's Residency Requirements Amendment Act of 2023. It's going to be a lengthy markup, so just settle in for those who are watching, because I have a lot to say, and these are some meaty bills that my great staff has been working on. But in terms of these particular nominees and this roundtable, the time is 12:41 p.m. and this hearing is adjourned. Thank you all so much. Thank you, everyone.
Thank you.
Thank you.
Thank you.